So, I mean, lung transplant is really a therapy that someone might be referred to when their function declines to the point that it would be expected that they might survive longer having a lung transplant as opposed to not having it. It's not really a procedure done for quality of life because there's no guarantee how it would turn out, but certainly when it is performed and it is successful, it can have a significant improvement in someone's quality of life. But even after transplant, I mean, patients do require frequent follow-up, frequent medical evaluations, and certainly need to continue on multiple medications on a daily basis, so they may be a little different. It is a complicated procedure that has risks of its own, and you really wouldn't want to do that until someone really needs it. I always say that the longer you can keep your own after transplant, most of their care is with the lung transplant team, as the major medical issues become transplant related. Well, I think one of the things that distinguishes us is our team, which has really been together for a long period of time, so there's a lot of experience. The other thing is that we really do have an independent adult program with all of our own team members dedicated only to adults, and all of the necessities in the hospital that adults require. Finally, I think one of the strengths is also some of the research that we're involved with here. We've been involved with some of the really cutting-edge studies that are looking at new therapies which really aim not to treat the end product of the disease, but really to try and attack the disease at the molecular level and the level of the protein, to see if we can restore function of the CFTR or CF protein in order to treat the disease at its root, and hopefully at that point, if these therapies work, really make a difference in patient survival. We've been involved in a number of recent studies, and some are ongoing right now, and it remains to be seen how these drugs, which seem to work well in the lab, hold up when they're tested in real people.